Hi, I am Dr. Heerani, and I will be talking through how I do role plays among 5 or 6 students in my teaching session. First of all, I go through the SPIKES protocol, SPIKES, as part of the theory and knowledge. Then I allocate each student an alphabet. I will be looking at every student in turn so that they know that I am now targeting them and it's their turn to take over. At my S student, which is S for setting, I will start by saying, "Oh, hi, are you the doctor here today?" I would expect the student to say, "Yes, I am Dr. Y. Would you like to come in this private room? I have a nurse with me here. Would you like to bring anybody else with you in the consultation? Would you like a cup of tea?" Then I will move on to P, perception. That's when I expect the students to check my knowledge of what has been going on. I might even say, "No, I'm not sure what's going on." And that student might need to tell me briefly about what has been going on in the hospital stay. Then I will move on to the next student for I, invitation. I would expect that student to check with me if I'm ready to obtain new information and to double check if I wanted anybody else to come with me in the room in the case of bad news, for example. I would also start with K with that particular student. I would like the student to explain to me what has been going on, but also I might ask a few questions around. For example, in the case of the use of anticoagulants, why do I need that? What does that mean? And the next student could also be allocated to K, and I'll move on to, for example, the complications of it. Oh, would that bleed? What happens if I go to the dentist? And then I'll move on to E, empathy. At this point, I will raise an unhappy situation, that I'm not happy with the way that my father has been treated. I would like the student to offer me PALS, Patient Advice Liaison Service, in the UK, or arrange a meeting with a consultant, or even incident reporting. I might even expect an apology at this point. Then I'll move on to the last student for S, summary and strategy. I would like that student to summarize what has happened throughout the whole consultation, provide me with a leaflet, contact information, thank me, and also safety net the consultation. Thank you very much for listening, and I hope that you enjoyed this technique of doing a role plays with few students.